Welcome back to the Deep Dive. Today, we're going to cut through the noise and get straight to the heart of what matters for overseas qualified dentists aiming for Australian registration. We're doing a full deep dive into the official documents around the Australian Dental Council practical examination, the ADC exam.
Right.
If you're approaching this final assessment, you know the stakes are just incredibly high. So our mission today is to give you the shortcut. We're detailing the big structural and content changes coming in 2026. What exactly is shifting and, what does this mean for how you need to prepare?
And it's such a vital discussion. The ADC's mandate is, first and foremost, public protection. They have to be sure that an overseas practitioner meets the standards of a newly qualified Australian dentist.
Yeah.
So the bar is set quite high.
And this practical exam is the final hurdle in that process, right?
It is. For general dentists, you've got the initial assessment, then the written exam, and then finally this intensive practical assessment.
Okay, so let's unpack that. Let's focus on that final 2-day practical hurdle, because the changes coming in 2026, they're really significant.
They are.
We have to start with what seems like the most immediate, most impactful shift for general dentistry candidates.
Absolutely. That would be the removal of the amalgam placement task. It's gone from the practical exam blueprint.
Wow. Okay, so for anyone who's been prepping with the old guidelines, that's a profound change.
It's a game changer.
It really is. I mean, previously, the technical skills day could include things like a complex amalgam restoration. So tell us about the timeline and the reasoning behind taking this out.
Sure. So this officially takes effect starting from period 2 in 2026. And the rationale, it's really rooted in this global move towards, sustainability and patient health.
Right.
The ADC is aligning with global policy, specifically the Minamata Convention on Mercury. Australia, like a lot of developed nations, is phasing down dental amalgam. The exam has to reflect current best practice.
In contemporary dentistry, it's mostly mercury-free materials now. So let's look at this through the candidate's eyes. The overseas dentist, they're already under immense pressure. How is this change, this deviation, actually better for them?
Oh, it's a massive advantage, both strategically and, practically. Amalgam work, it requires its own specific materials, its own equipment, a very distinct technique.
Completely different from composite work.
Completely. So by removing it, the ADC is making sure the skills you're tested on are what you'll actually use day to day in a modern Australian practice.
So it's about relevance.
It is. But think about the prep time. This allows the overseas candidate to reallocate dozens of hours of study. Instead of mastering a technique that's being phased out, you can focus that critical time on, say, refining your margins for a complex composite or really understanding advanced endo access. Those skills aren't going anywhere.
That reframes it entirely. It's not that the test is just getting simpler, it's getting more targeted, more current.
Precisely. The ADC is assessing where the profession is going, not where it's been.
And just to confirm for everyone, all the other core parts of the general dentistry exam, the conservation, endo, fixed prosthodontics, those are all staying, unless there's some other advice.
That's correct. The core focus is still there. The curriculum has just been modernized.
Okay, so this is where it gets really interesting, because they're not just changing what they test, they're also upgrading how they test it. The actual simulation infrastructure is getting a major overhaul.
Absolutely. The commitment to realism here is pretty striking. Also starting in period 2, 2026, the technical skills day. So that's the day in the simulation clinic with the mannequin heads.
Right.
They'll be introducing these new high-performance platinum range teeth.
Platinum range teeth. Okay, tell us more about those. What's the real benefit here? Why make that investment?
These are not your standard plastic teeth. They're engineered for a highly realistic simulation. The main improvements are tactile feedback and a uniform cutting response.
What does that mean in practice, uniform cutting response?
It means when you're doing, say, a complex class 2 prep, the material is designed to respond to or much more like real tooth structure would.
Oh, okay.
This cuts down on the variability you get with inconsistent or, overly hard sim materials, which has always been a source of frustration in these kinds of exams.
So thinking about the candidate again, how does this help them? I mean, doesn't a more realistic test potentially make it harder?
That's a fair question. And while, yes, realism makes it more authentic, it actually benefits the candidate by standardizing the test environment.
How so?
Well, overseas dentists come from all sorts of different educational backgrounds using different materials. These teeth aim to level the playing field. Your result will hinge more on your actual clinical skill and handpiece control, not your ability to adapt on the fly to a weird, unpredictable plastic tooth.
So it's an investment in the fairness and the validity of the results.
Exactly. It's a move from low fidelity to high fidelity simulation, which is what you want in a high stakes exam.
Right. And before we dig into the scoring, which I know is what everyone's worried about, we should probably just touch on how the whole exam process is changing for other professional categories.
Yes, good point. For dental hygiene and dental therapy candidates, there are also big changes coming in June 2026.
So it's not just the dentists.
No, their assessments are moving away from just a list of procedures. Instead, they'll be organized around clusters that align with professional competencies of the newly qualified dental practitioner. It's a more integrated, holistic approach.
So just a quick recap for the general dentistry candidate listening. It's a 2-day exam. Technical skills day is procedural in a sim lab.
Right, on mannequins.
And the clinical skills day is the OSCE, the objective structured clinical examination. 10 stations, usually with simulated patients.
Correct. And both are designed to test skills for safe, everyday practice in Australia.
Okay, so now we have to address the big question, the one everyone is asking.
Yeah.
With amalgam gone and better sim teeth, will the exam be easier to pass starting in 2026?
Unequivocally, no.
Straight answer.
It has to be. The changes modernize the content, but they do not lower the standard. The ADC's goal is protecting the public. That means ensuring you meet the competencies of a new Aussie graduate. That standard is non-negotiable.
And the assessment model is built to be tough.
It is, because the stakes are so high. I mean, look at the structure. The Technical Skills Day has 6 big tasks across conservation, endo, and fixed pros. That's all about your dexterity, your procedural skill.
And then the OSCE day is completely different.
Completely. It's 10 stations testing broader skills. Clinical information gathering, diagnosis, management planning, treatment, evaluation. That's where your communication and clinical judgment are really put under the microscope with actors playing patients.
And this brings us to the absolute core of why this exam is so challenging, the scoring model. You mentioned a partial compensatory test scoring model. What does that actually mean for a candidate?
It's the gatekeeper. Partial compensatory means you can't use an amazing performance in one area to make up for a failing grade in another.
Okay, break that down.
The single most important rule is this. You must pass both the Clinical Skills Day and the Technical Skills Day at a single attempt.
So let me get this to you. If I am a world-class technician, I can do a perfect crown prep in my sleep. But I fail 3 OSCE stations because my diagnostic planning is off, or I can't communicate effectively with a simulated patient, my whole attempt is a fail.
That's precisely it. Your technical brilliance on day 1 cannot save you from a failure on day 2.
Wow.
They're testing 2 different but equally vital domains, technical skill and clinical judgment. A deficit in judgment is just as dangerous to a patient as shaky hand skills. So this forces you to prepare equally for both. You can't just spend 90% of your time on a bench test.
And the rigor goes even deeper, doesn't it? Down to how individual tasks are rated with these detailed checklists.
It does. The global ratings are broad, outstanding, pass, borderline, fail, bad, fail. But the checklists define exactly where the lines are drawn.
So let's contrast them. This is vital for preparation. What does satisfactory look like?
Satisfactory allows for minor, easily corrected errors. Think of like a tiny bit of excess on a restoration that you can easily polish off. Something that wouldn't really compromise the final outcome. An error that a competent operator might reasonably make under pressure.
But the jump to borderline is pretty steep.
It is. A borderline rating is for more major deviations. These are things that should have been corrected and that would compromise the outcome to a minor extent.
Like what? Give us an example.
An open margin that needs significant work to fix, or a crown prep that's a bit under-reduced. The ADC's own language says these are deviations that should not often occur from a competent operator. You're already in a danger zone.
And then there's unsatisfactory. This is the real gatekeeper.
This is the hard line. An unsatisfactory rating means a major catastrophic error. The definition is explicit. These are issues that cannot be corrected. The whole procedure is a wash. You'd have to start over. Or deviations that would significantly compromise the clinical outcome. A pulpal exposure during a prep, gross overreduction of tooth structure, misidentifying a critical landmark.
And the wording is key.
It is. The ADC says these are deviations that should not occur when the task is done by a competent operator, period.
That detail is chilling, but it's also incredibly valuable. It turns prep from guesswork into a focused mission to eliminate those fatal errors.
It has to.
So when we put this all together, what's the big picture for 2026? The ADC has modernized the test. They've removed outdated things like amalgam, which aligns the exam with modern global standards.
Right.
And they've improved the testing realism with the platinum teeth, which is actually better for candidates because it standardizes the environment.
The core takeaway is that the exam is staying relevant and high fidelity. These changes help you by making your prep time more focused on modern clinical reality. Despite all these modernizing steps, the fundamental standard of competence for safe practice in Australia, that remains the absolute non-negotiable threshold. And that's enforced by the rule that you have to pass both days separately.
It really underlines that this isn't about hitting some kind of average. It's about a consistent level of excellence and, most importantly, avoiding those catastrophic, well-defined clinical mistakes.
Mastery of both execution and judgment.
Which brings us to our final thought for you. Considering the ADC has published these incredibly detailed criteria for what makes an unsatisfactory performance, I mean, deviations that cannot be corrected or should not occur. Think about that. How should this extreme level of detail change your entire preparation strategy? It should encourage you to move beyond just trying to be good enough to pass. It pushes you to focus on truly mastering these contemporary safety-critical procedures. Your goal should be to ensure that no error you make, technical or judgment, ever falls into that explicitly defined catastrophic zone, that kind of targeted focus. That is the difference between passing this thing and having to try again. Think about that rubric as you plan your next hour of study.